afternoon, everyone. My name is Mornay. Welcome to part 10 of the Brown Bag series. I'm a proud Bertha scholar, and I'm honored to be able to chair this session, which promises to be incredibly interesting and informative. As you've no doubt seen, Gillian Vedan is our speaker today. She's a remarkable individual with a passion for finding innovative ways to make healthcare accessible, affordable, and equitable for all. Very accomplished. Amongst her qualifications, she holds an MBA and an MPH, Masters in Public Health from top-tier South African institutions. And she's currently a much-loved asset, part of the Bertha Centre's health financing team in her capacity as a senior project manager in collaboration with the South African Medical Research Council. So today, Gillian will be presenting a report compiled by the Bertha Centre through support from the Bayer Foundation and the World Economic Forum's Global Alliance for Social Entrepreneurship. And the report is entitled Inclusive Health, Sustainable Agriculture and Climate Change, an analysis of the intersection in Latin America and Asia Pacific. This report explores the complex interplay between three seemingly disparate topics or sectors: health, agriculture, and climate change in Latin America and Asia Pacific contexts. So today's Brown Bag will give a glimpse into some of the findings, and although it focuses on Latin America and Asia Pacific, many lessons can be shared across other contexts. So looking at these intersecting concepts helps us to evolve our understanding of the structural inequalities in societies while contributing to a wider social justice goal. So before I call upon Gillian, I'm going to invite all attendees to engage with Gillian through posting of any questions or comments in the chat function during her presentation. And then these will be addressed after the presentation in the hope to have a nice, robust discussion to further our understanding on the take-home messages from the report. So without further ado, I'm going to call upon Gillian to take over and give us today's Brown Bag series.
Hi, Monet. Thank you. Thank you for those kind words and the introduction. And hi, everyone. Thank you for joining us, and thank you for your interest in the work that we do at the Bertha Centre. Yeah, it's great to have you here, and yeah, it's exciting to be on a Friday afternoon and just chat about some of the exciting things that we've done. So to set a bit of background to this, the Schwab Global Alliance for Social Entrepreneurship was interested in how food insecurity, health, and planetary considerations interact with one another. So they were mainly interested in the reduction of food waste, improving nutrition in different contexts, also improving healthcare in rural settings, and also what does this look like with the threat of climate change looming, and the resources that we have at hand. So it seemed very overwhelming when we got the brief, but it was also very exciting because this was our first foray into the intersection of health and climate change. And as the Bertha Centre, we're moving into that direction. We are going to get a climate fellow on board soon. So we are eager to explore how climate intersects with each one of our portfolios. So the methodology used for this analysis, we partnered with an organization called Impact Intelligence, who does a lot of work with AI-driven models for analysis. So they used something called a large language model, where they programmed it to read different parameters. It was text-based, so they could only focus on things like news articles, academic publications, social media posts, and yeah, they just did basically an internet sweep. So they found in excess of 2.5 million data posts that they distilled and refined. There's a lot of back and forth. It was an iterative process with a lot of stakeholders and the rest of the team. And we finally distilled it into a total of 21 barriers and 109 sub-barriers that feed into those. So it was a massive undertaking. It took about 10 weeks for the analysis to take place, and we had some data validation workshops at the beginning of last year. Then our team at the Bertha Centre conducted validation interviews with different stakeholders. This included social innovators and social entrepreneurs, some of the impact investors, some of the multinational organizations involved in the ecosystem. And yeah, we just try to interrogate those findings as much as possible. And the outputs for this, so we released a report at Davos earlier this year in January. There was a long form report and a digital one. And next week, a shorter report is being released at the Skull World Forum. So that's also a social innovation and entrepreneurship conference, a global one. I think there's some big heavyweights. Amal and George Clooney will be there as guest presenters, apparently. And our director, Solange, is gone to represent the Bertha Centre at that conference next week. So that's quite exciting. And then there's a QR code on the right-hand side of the screen. So that takes you to an interactive dashboard by Impact Intelligence. So that's your Power BI data visualizations. You can deep dive into country hotspots. You can look at the other 21 barriers that are there and the sub barriers and check how they all interplay with one another. So it's really cool when you have a few minutes, and if you're interested in exploring the other topics, please, yeah, take a look at that. It's quite fun to play around with. And moving on, these are the 21 barriers that were identified in the study. The ones to the left of the screen are the big ones that we found, and sorry about the formatting, but the ones to the right of the screen are the smaller ones, so we won't worry too much about that. But yeah, if you want to take a look at them more, then go to that Impact Intelligence Data Visualization Dashboard. So yeah, the main ones that came up were food insecurity, dysfunctional food systems, health systems that were broken, or lacking in proper function and service. And what also came up was extreme weather events and the impact of greenhouse gas emissions. So they looked separate from one another, but as we dived in deeper and explored these topics more through our research, we could see a complex interplay between all of them. And yeah, I'll give you a few of them through this presentation. We won't spend the whole Friday going through all 21 barriers today. Interestingly, we tried to add a gender lens in this. So one of the barriers that we found was gender inequality, which was present in both continents. So it obviously had a strong gender score. Then there was stigmatization and lack of awareness, especially in the health context, when people considered public health access. A lot of women head households and make decisions pertaining to food and nutrition and what the family will eat. So there was a strong gender correlation over there. We could also see the influence that climate disasters had on women, especially in vulnerable contexts. So that a lot of that came up, and political instability and conflict. There's a whole lot of 15 barriers down there that I didn't want to squeeze into this graph and make it look unpleasant to the eye. But down at the very bottom, we saw that gender did not affect or did not have any influence on supply chain disruption. So irrespective of what gender people were, supply chain disruptions across healthcare, across food, across pharmaceuticals, it affected everybody uniformly there. Moving on to the gender ranking by continent. So we could see in Asia Pacific, there was more of a gender imbalance when it pertained to the healthcare system and accessing public health and malnutrition. Whereas on the Latin American side, we could still see the long-term consequences of COVID that came up, which is quite surprising. We thought everybody kind of forgot about the pandemic, but here it is rearing its ugly head, and leaving some nasty consequences there. And also the environmental impact was felt more or related more strongly to gender in Latin America. So that was quite interesting to see how the different regions showed up in that analysis. And sorry for everybody, I didn't clarify, but the terminology that we used in this analysis. So the barriers refer to those big 21 themes that we first saw. These were further distilled into 109 sub-barriers, which was quite a lot, and that's where we saw the intersections taking place. The data points refer to academic research, news publications, reports, all of those text analyses. That's what fed into those barriers and sub-barriers. And then we also looked at enabler and solution scores. So enablers refer to the environment and the ecosystem that enables different innovations, and the solutions refer to specific innovations that we came up, that we encountered through our analysis and interviews. So to dive into food insecurity and the barriers that were present over there, we could see there was a lot of macroeconomic and policy influences that contributed to this barrier. But we also noted the lack of cooperation. So not only among governments and multinational organizations, United Nations Food Program, World Health Organization, it's not limited to those. You also need people to invest. You also need innovators who work in the space. And that's where the biggest barrier was present. So we could see the macroeconomic policies had more of an influence in Asia Pacific, and then the lack of food production or cooperation had more of an influence in Latin America. So it's interesting to see. And here the yellow refers to how enabling an environment is. So we rated them out of 5. And the green bars refer to the solutions that came up also out of 5. So as we could see here, there's a strong enabling environment, but I think the solution space still has to come and cover up and meet that gap. Some of the interesting innovators that we spoke to, in Brazil, there was CREN. It's in Portuguese, but loosely translated, it refers to the Center for Nutritional Recovery and Rehab, something like that. But they look at the intersection of nutrition and mental health. We interviewed a really passionate Prof. Gisela Solomos from the center who headed it up. And she was interviewed on one of our podcasts. So if I'll supply podcast details later on, but that will be a really interesting conversation to listen to. And you can see her passion come out for that project. Next, we interviewed Faala Vanilla. They were from Samoa. It was interesting to see how their government's emphasis on exporting food from the country was so huge, while neglecting the population that lived in country as well. And Faala Vanilla is looking at sustainable agriculture, specifically in vanilla, and they are building a platform for other farmers who are women in Samoa, and just enabling them to get their produce out there to access the market and sell their produce. So it was also very interesting to chat to them. A bit of a challenge with the time zones and coordinating that, but it's truly inspiring, the work that's being done over there. Next up, there's the public health and well-being barrier, and some of the sub-barriers that contributed to that. So we are not surprised by mental illness creeping up, chronic and infectious diseases. I think that's pretty normal in the work that we've done. But what was surprising was the impact of climate change on public health and well-being. Perhaps this was more retrospective data that was used, but I think this is a much smaller share of the barrier than we anticipated. Perhaps with future research and future undertakings, we'll see those bars actually growing across both regions, perhaps even overtaking mental health, infectious diseases and chronic diseases. So yeah, that was a bit of a surprising fact that we saw. And yeah, we could see that there's a strong enabling environment in public health and well-being, and the solutions are matching up to it and meeting the need out there. We know through our network, even in SciHi, the Social Innovation and Health Initiative, there's a lot of innovations going on in healthcare. So definitely the gap is being met over here. And I think especially after the COVID-19 pandemic, regulations surrounding healthcare were eased up a lot, and it enabled social innovators to come to the fore and bring their ideas to fruition. So we interviewed Umana Red in Argentina. They provide a platform for people or patients to access specialist healthcare at a reduced rate. And then we also spoke to Medtronic Labs in Bangladesh, which builds capacity among community healthcare workers and uses a lot of technology in their innovations. So that was exciting to see the work that they do. And moving on to agricultural yields and soil fertility, which came up as one of the big barriers in the analysis. So once again, we could see there's a huge gap to sustainable innovation and investment. I think agriculture has taken a back seat compared to other development priorities. We're not sure what's the reason why, but yeah, that was one of the concerns raised by both Asia Pacific and Latin American colleagues. And then also climate change and pollution impacting crop yield that posed a bigger challenge in Latin America. They were already seeing some of the challenges with that. And moving on to the enablers and solutions, yeah, there is a very enabling environment for agriculture, but I think more work needs to be done in developing social innovation solutions that address this barrier. So we spoke to Colombian colleagues, Ecosistema Hagua. They provide a platform for farmers to bring their produce to market. Yeah, in quite a few of the interviews with Latin American colleagues, there's this heavy Spanish accents there. So some of the understandings were lost, but we hope that we could get the gist of the innovations and what they do. And then in Bangladesh, we spoke to iFarmer, which tries to encourage small-scale farmers to uptake insurance, especially with the natural disasters that Bangladesh is vulnerable to. They try and get farmers to opt in. I think what we heard, there was a lot of skepticism from farmers to say, why do you want me to pay more? What kind of scheme is this? But slowly but surely, the farmers are seeing the importance of having insurance for their crop yields and farms. Next up, we uncovered weak healthcare capacity. So this is a systemic and structural problem everywhere. I think that's where the lack of preventive measures and weak screening comes into play. A lot of health systems are still heavily focused on the curative side rather than the preventive side of health. So it's just a knee-jerk reaction that comes with that. And also there's a lack of advancements in tech and medical innovation. So I think although there's been a lot of exciting developments in the field, I think there's still a lot of work that needs to be done, both in Latin America and in Asia Pacific. So yeah, as we can see, there's an enabling environment. It offers the ecosystem, it offers the lack of regulations to make it easier for social innovators and entrepreneurs. But yes, more work and more investment needs to be done in these areas. So in Pakistan, we spoke to Doctors, which provides healthcare access and more trained healthcare providers for patients. And we also spoke to Aravind Group. So I don't know if anybody knows, but we've mentioned them as a case study in our lectures before. They do cataract surgery. They do, it's kind of like what do they call it? Like a very efficient system. So they put patients there and it's done using economies of scale and it's heavily subsidized so that the poorest of the poor do not have to pay for cataract surgery that they need. But interestingly, the colleague from Aravind Group told us that a few years ago, they had a program specifically for children where they would screen them for eye conditions and things, but also give them nutrition packages. So foods that were heavy in vitamin A and had been fortified with other nutrients. So you can see, although they focused on eye care alone, they tried to expand it and make sure that nutrition forms part of that health package of services. In Latin America, we spoke to CIEDS. Also, it's another Portuguese abbreviation, but basically what they do is they provide a holistic package of services to youth that come from rural areas into urban areas. They give them mental health support, employment support if they need to be trained for anything, and also assisting with nutrition and social development. And there's also a very passionate colleague from there. It is like infectious to speak to him. Also a really good work being done there. And for the fifth barrier, we looked at extreme weather events and how that contributed to the problems at hand. So there's definitely a lack of humanitarian aid and infrastructure. I mean, organizations can do more, plenty more in that area. And climate change and pollution increasing the risk of these events happening in future. I think it's imminent. And then it also links with the mitigative and adaptive climate change investment. So I think what we learned through this study is that we've gone way past the mitigative interventions. Now it's just adapt or like fall apart kind of thing. So I think you know, people are just very reactive when it comes to that. There's a lot of things when the event happens, but there's not enough proaction in the space. And I think we tried to call for that through investments, not only limiting them to insurance companies, but other impact investors as well, just to have a broader scope and look at that. And looking at the enabling factors, yes, I think more people and stakeholders are realizing that this isn't a problem that needs urgent addressing. And all of the barriers are being released and addressed here to create a more enabling system. And I think social innovators are catching up to it as well. So for instance, we spoke to Lat Impacto, which is the sister organization of the African Venture Philanthropy Alliance, which is one of our partners, and also the AVPN, which is same organization that works in Asia. So they said their members are increasingly concerned with climate change and the risk that it poses, and they are eager to make investments in those areas. We can't quantify the investment gap, but it is there, and I think more work is being done to explore that and what it looks like and where the most more impactful investments can be made. In Asia Pacific, we spoke to an organization called Friendship. So they started off with these big humanitarian ships, hospital ships, they call it. So that's when disasters strike and the ships are called in to respond. But they also, what picked up my interest was a mangrove reforestation projects. So I think Bangladesh is very prone to typhoons and floods in their area. So they're trying to build mangroves to act as a buffer against all of these natural disasters. And they also have a really cool school. If you go to their website, they built a school in a structural way, and it's resistant to natural disasters, and it can double up as a shelter. So it's quite an innovative thing that they're doing, and they've got their hands in a lot of projects, especially climate adaptive interventions that they're incorporating into their humanitarian work. And we also spoke to Nazava Water Filters. I think they are headquarters somewhere in Europe, but they have branches in Thailand and one in Kenya. So when that huge tsunami hit a couple of years ago, they had the parts to build water filters, but they transported it to the affected regions, and they said, you know what, here's a way you can earn an income. You just need to assemble these water filters. You can take them as well. They've also partnered with the microfinance institution to subsidize these water filters for women and schools and communities who are hard hit by floods or who don't have access to safe drinking water. I think also in areas where there's archipelagos of islands and there's no centralized water, water treatment plant. that's where the water filters come into play. So yeah, it was also really fun talking to that colleague from Nazawa and learning about the work that they do. So in a nutshell, these 5 barriers that I mentioned earlier, I've plotted them on this matrix. So to see against the average solution scores and the average enabling scores, enabling environment scores. So basically the green triangle indicates the areas where you can make quick wins with easy investments. There's plenty that you can do and plenty of impact that can be made. And the red triangle indicates a more structural and systemic problem. So I didn't plot all of the other 15 bubbles here, barrier bubbles, because that would have just overwhelmed everyone. But gender was quite low in the red triangle. So that shows that it is a structural and systemic inequality that needs plenty of time, plenty of policy, plenty of investment, and an enabling environment from all sectors and collaboration between all stakeholders for that to move up in the matrix. I think there was also one on water and sanitation. That bubble was also somewhere in the red quadrant. And yeah, some of the easy ones, they were very small bubbles over here. I can't remember them off the top of my head now. But if you go to that interactive dashboard by Impact Intelligence, you can see the rest of the bubbles and where they lie in this matrix. And yeah, oh, sorry, just to say before leading to that matrix, it was difficult to quantify the investment gap for these, especially since the scope of the project was so large. It's 2 continents. It's not even like a deep dive into a specific country. So I think with the time that we had and the level of data that we had, we couldn't quantify the investment gap. But I think that will definitely require further analysis and further study in future. But yeah, it'll just take more of a deep dive in the work that we do. And yeah, just to say thank you to everybody who contributed to this project, to our partner organizations, to all of the interviewees, the social innovators, the multinationals that contributed. We are immensely thankful. And for more information, please feel free to email Katusha or myself at the Bertha Centre. Like I said, the QR code on the left, that's for the interactive data dashboard where you can see the visualizations. The QR code on the right is from the World Economic Forum. So they do something called transformative maps. So it's similar to a systems map, but all of the themes that I spoke about, you can select and play these with these bubbles, and they'll show you the interlinks between all of the different priority areas. Take a listen to the Just for a Change podcast. You can find it on Apple or Spotify, where we featured one of the profs from the social innovations that we spoke to. And there's also an Investec or Bertha's podcast series where we focus specifically on South Africa and what we can do here. And yes, there's plenty of reading material. If you reach out to us and if you want to learn more, you are more than welcome to get into contact with the Bertha Centre. Thank you.
Great, thanks, Gillian. That was very informative. An absolutely huge undertaking, it seems. Covered geographically quite a vast area. I'd like to, I don't see any questions popping up in the chat, so I'd like to ask any of the attendees if they do have questions, pop it up in the chat, or you can raise your hand and chat to Gillian directly. I've jotted down a few questions in the meantime, and I thought there was one burning question right from the start, and then something else that I'd like to transition to. But mainly, if we had to see the relevance of this research, or first the matter of this research and the style of research, the relevance within the African context, do you think the first part of the question is, do you think such type of research is feasible given the research output currently available that AI can scan, and then I'm sure contacting stakeholders and so forth complementing that output. And then the second part of the question is the outputs from this, how relevant are they to our current setting, to the African context? Yeah, and we could start off with those.
Thanks, Monet. Yeah, that's a huge question. I think definitely there are implications for Africa. It might not look the same in terms of numbers, but I think the same sort of themes would come up, especially as we consider last year they said we passed the halfway mark for SDGs, and we are still very far behind on a lot of targets that we need to meet. So definitely, I think it's something that we need to consider, especially as the vulnerable populations in Africa are more susceptible to the effects of climate change, and food security and diseases as well. So I think, yes, definitely, if anybody is interested in sponsoring that study, and partnering with Impact Intelligence, we are good to go. We did a report on Africa in 2022. But that was focused specifically on the recovery after COVID-19. I think it would be so interesting to see what it would look like with the intersection of climate and agriculture. And yeah, we have the networks, we have the connections, we have our SciHi branches throughout Africa that we could also speak to. So I think it will be a lot easier to speak to those stakeholders as well compared to this.
Yeah.
And in terms of AI, yeah, I mean, this study was fascinating the way they did it. We are not too clued up on the text side of it, but we can definitely put you in touch with colleagues at Impact Intelligence to give you a more technical breakdown. But I think perhaps in future it would be really interesting to see analysis of like video or audio incorporated into these study designs. So not limiting it to text only, because I think a lot of organizations, I mentioned AVPA, AVPN, and Latin Impacto, they run webinars and things. So it would be nice to analyze that. Maybe we could get an idea of the investment gap needed for all of these priorities. So yeah, we don't have access into that part of it yet, but perhaps AI models will help us to do that soon.
I'm going to head on to another one I jotted down now. I see lots of the more qualitative aspects or investigations that you did as part of the report included discussions with stakeholders, either investors or entrepreneurs or innovators. How was there any engagement or perspectives gathered from government representatives or governmental representatives, or was it largely NGO or private entities that were engaged with?
Yeah, unfortunately, we missed the government voice here, and it was the same in the previous report that we did. I'm not sure, perhaps they are too busy, and maybe we don't know the right people to speak to in government sectors. I think the closest that we got was a prof at a publicly funded university. But otherwise, yeah, I couldn't say like somebody who sits in a ministerial office or something. So that was a sore point of the study. But hopefully this reaches them either through the World Economic Forum platforms or some other way. Hopefully they'll get to see this and help to create that more enabling environment for social innovations that tackle these priorities. Yeah.
Cool. Thank you. I don't see any other questions. Maybe if you'd like to use the opportunity now just to speak to any upcoming courses or events that the Bertha Centre is putting on that some of the attendees could attend or show an interest towards.
Yeah, thanks, Monet. So something very exciting. Last year we hosted the first Impact Investing in Africa conference that was at the Cape Town ICC. This year we are taking it to Kenya in July, and it's also being accompanied by an Impact Investing in Africa course. So that's one of our flagship courses at the Bertha Centre that we offer at the GSB, and yeah, now we're taking it over. So if viewers on the call, if you would like more information, if you'd like to learn more on how to apply for that course, please get in touch with us via any one of our social media channels, or you can pop us an email and we would give you more information on that. And yeah, just stay tuned. There's a lot of brown bags, there's collectives that happen, there's podcasts. It's a very exciting space. There's a lot of work going on by the rest of the colleagues at Bertha Centre. So yeah, please follow our channels and you can learn more and see what piques your interest.
Great, thank you. So I love the solution and opportunity focus or the lens of this research output. It wasn't just giving the barriers, the sub barriers. There was a nice focus towards solutions. And so I see Natalie's got a question there. You can go for it, Natalie.
Hi, Gillian. Thank you so much. This was amazing. You know, I was wondering what was actually happening around the rest of the world because I'm having, the results that you actually put up. I was surprised to see that a lot of it is very relevant to here, and the one that definitely blew my mind a bit, but not, I think it's not actually that surprising, is that COVID, the long-term COVID, and how that's actually affecting. What I wanted to ask is there any success stories of actually, based on the barriers that's been identified and through social innovation that has actually practically been implemented and still going and actually making, like, maybe it started out being like a bit of a pebble, but it's still going, and is the impact still growing, out of the research that you've done, or is that something that you have info to?
Yeah, no, thank you, Natalie, for that question. I think a lot of the social innovations that I mentioned through the presentation, they started off as a small seed, and the direction they take, like I never thought a water filtration company was going to partner with a micro lender and enable those things, or farmers going to a major insurance company and saying, listen, we need some protection for our crops. So it's all of these social innovations that came up, and I think we also saw the proliferation of mental health innovations. So yes, it had have started off like a small thing, oh, let's help people during the lockdown. But the directions and the spin-offs that they're taking, it's remarkable to see. And I think all of these innovators, and even the report that we did on Africa, we still keep in touch with them and follow their progress. So yeah, the fact they're making is exciting. And I think, yeah, we can focus on them through our social innovation and health initiative. And yeah, if you're looking to get in contact with anyone specific, we can definitely facilitate that.
I'll definitely drop you an email. Thank you. So I was actually looking forward to this information, data, the answers in the data, So thank you so much. Time well spent. Thanks so much.
Thanks, Natalie.
Thanks, Natalie. So one final check to see if there aren't any other questions or any other hands. I don't see anything on my side. So there you go. So with that, I'd just like to thank the Bertha team and Gillian particularly for giving us such a lovely overview of this research output. I'm looking forward to getting stuck in and reading the full report. Still have a few questions related to the nuances of how specifically gender impacts on many of these climate change associated, but I'm sure the details are all in the full report, so I'm definitely going to get stuck in at some point. I'd just like to also reach out and ask all attendees to make sure that they're following Bertha Centre on all social media platforms and to ensure that they are signed up to get the Bertha newsletter. From that, you'll be able to see all the events and associated dates for important things to be on your radar or on your calendar. Yeah, so I don't see anything up. So I'm going to thank everyone for attending. It's been a lovely session, and I hope you have a lovely end to your week and start to the weekend.